Andy Johnson, Minnesota State University, Mankato. This is part 5 of a series of videos looking at children and adolescents' mental health issues. The onset, and we're looking at schizophrenia here. If you haven't noticed, the onset usually occurs in adolescence. It is a severe and reoccurring mental disorder. It affects approximately 1% of the population and causes people to think and act strangely. So that means 1%. If you have 25 students in your class every year, that means in 4 years at least one, or probably one of your students, might be or will be at risk for schizophrenia. It is delusional thinking, hallucinations, disintegration of the personality, and stymied or distorted emotional responses. Think of the movie A Beautiful Mind, the character played by Russell Crowe. Early signs can occur 2 to 6 years before the onset, and they involve these things: reduced concentration, attention, decreased motivation, drive, energy, mood changes, sleep difficulty, social withdrawal, suspiciousness, irritability, decline in role functioning, their role, whether it's academics or their job or neglecting appearance, etc., etc. Some of the symptoms or behaviors associated with the actual schizophrenia is confused thinking, vivid and bizarre thoughts or ideas, hallucinations, delusions, having beliefs that are fixed and false, and severe anxiety and fearfulness. Also, moodiness, problem in making and keeping friends, feelings that people are hostile or out to get them, odd behavior, including resembling that of a younger child, disorganized speech, and lack of motivation. Again, with adolescence and all the turmoil and turbulation, sometimes this is hard to detect. DSM-IV recognizes 5 subtypes or categories of schizophrenia. We'll go through each one of these real quickly. And again, the goal is not for you to diagnose, but to recognize and to understand. Paranoid, person suffering from this experience systematic delusions and auditory hallucinations. The delusions of grandeur involve a specific area. Sometimes the person thinks they are an exalted being, delusions of grandeur, or they feel they're being persecuted or spied on or plotted against. Someone's trying to kill them. Jealousy, they think their mate or spouse is unfaithful to them without any evidence. And religiosity, anxiety, anger, aloofness, and argumentativeness. With paranoid type schizophrenia, the cognitive functioning, their thinking is not affected, nor are their emotional responses. Disorganized type of schizophrenia, that is displayed incoherent patterns of thinking and speech, grossly bizarre behavior, or flat or inappropriate emotions, inappropriate to the situation. Catatonic type schizophrenia, the person displays some sort of disruption in their normal motor activity. It could be a rigid posture, remaining motionless for long periods of time, showing little interest to anything in their environment. Could also be excessive movement that's not influenced by external stimuli or anything in the environment. Undifferentiated schizophrenia is a mix of symptoms without falling into any other category. Again, you have delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior. And residual schizophrenia is that the current person has experienced at least one episode of schizophrenia in the past, but is currently free of any symptoms or displays only minor symptoms. This is the end of part 5. I have activities, video mini lessons at that website.